Clear cell renal cell carcinoma, VHL disease, clear cell renal cell carcinoma. Clear cell renal cell carcinoma occurs in familial, inherited, as well as sporadic non-inherited forms. And most well-studied in hereditary form of clear cell renal cell carcinoma is von Hippel-Lindau disease. Von Hippel-Lindau disease is an autosomal dominant inherited multisystem neoplastic disorder that is characterized by clear cell renal tumors, retinal angiomas, central nervous system hemangioblastoma, tumor of the adrenal gland pheochromocytoma, endolymphatic sac and pancreatic islet cell, and cyst in the pancreas and kidney. VHL occurs in 1 in 36,000, develops during the second to fourth decade of life, and nearly complete penetrance by the age of 70. Bilateral multifocal renal tumors with clear cell histology develop in up to 30% of the VHL patients, and that have a metastatic potential when they reach by 3 cm. Belzutifan, an HIF2 alpha inhibitor, was recently FDA approved for the treatment of patients with VHL associated RCC who were being considered for surgical excision, and in this landmark study 50% of the objective response was observed in renal lesions. Importantly, only one patient required renal reduction procedure compared to 250 patients procedures prior to the initiation of therapy, and this trial sets the stage for the use of systemic agents for the management of localized RCC. Belzutifan. Then genetics of VHL. VHL gene position on the VHL kindred localized the disease locus to chromosome number 3p2526, leading to identification of the VHL gene in 1993. VHL is a classic 2-hit tumor suppressor gene in which both copies of VHL must be inactivated for tumor initiation, usually by loss of heterozygosity, somatic mutation, or methylation of the wild type allele. Germline VHL mutations encompass the entire mutation spectrum and are located throughout the entire gene. VHL subclasses based on the predisposition to develop pheochromocytoma and a higher or low risk RCC have been established with a clear genotype phenotype association emerging. Germline chromosome 3p translocation clear cell renal cell carcinoma. Another form of hereditary clear cell RCC was initially identified in 1979 by Cohen et al., who described a family with a constitutional 3 to 8 translocation balanced translocation that co-segregated with bilateral multifocal clear cell renal tumors and loss of derivative chromosome carrying the 3p segment and different somatic mutation in the remaining copy of VHL were identified in tumors from this translocation family, leading to a proposed 3-step tumorigenesis model. The inheritance of the constitutional translocation, loss of derivative chromosome bearing 3p25, and mutation of the remaining wild type VHL, resulting in inactivation of both the copies of VHL and predisposing to clear cell RCC. BAP1 associated tumor predisposition syndrome of clear cell RCC. So mutation in the BAP1 have been identified a germline of individual form of small number of families with a genetic predisposition to the development of clear cell RCC. Additionally, individuals carrying heterozygous BAP1 mutations are at risk for developing other tumor types, including uveal and cutaneous melanoma, malignant mesothelioma, and loss of heterozygosity of the BAP1 was demonstrated in the tumors from BAP1 mutations carries confirming BAP1 as a classic 2-hit tumor suppressor gene. BAP1 mutations carriers are characterized by early age of onset, an aggressive form of RCC that is associated with poor survival. Clinical trials significantly specifically designed to test potential therapies for BAF1 associated RCC have not been reported, but the cohort from the COMPARTS trial of treatment naive advanced metastatic RCC patients treated with VEGF targeting therapies, BAF1 mutations were associated with a reduced PFS and overall survival. In sporadic clear cell RCC VHL gene, somatic mutation of the VHL gene with associated loss of wild type allele is found in up to 92% of the tumors from patients with clear cell kidney cancer. VHL gene mutation is not found in papillary chromophore collecting the medullary other types of kidney cancer. Functions of the PHL protein PVHL. PVHL binds to elongin C, elongin B, and culin 2 forms of E3 ubiquitin ligase complex that target hypoxia inducible factors for ubiquitin mediated proteasomal degradation in an oxygen sensitive fashion. Under normoxia, HIF alpha becomes hydroxylated on critical prolines by prolyl hydroxylase, and PVHL then binds to hydroxylated HIF alpha, targeting HIF alpha for ubiquitination by the E3 ligase complex. And under hypoxic condition, when this propyl hydroxylase are unable to function, when PVHL is mutated, thereby altering its binding to H hydroxy inducing factor alpha or elongin C, and this HIF alpha accumulates and transcriptionally upregulates a number of genes important in blood vessels development, that is EPO, VEGF, cell proliferation, PDFG beta, and TGF alpha, and anaerobic glucose metabolism, GLUT1. HIF2 alpha rather than HIF1 alpha stabilization appears to be critical for renal tumor development. An additional gene mutated in clear cell carcinoma is large cell scale genomic studies performed to identify the genetic basis of clear cell kidney cancers have revealed genetic alteration in genes important for the maintenance of chromatin states. Significantly mutated genes identified in sporadic clear cell carcinoma, in addition to VHL, include PBRM1, encoding a subunit of the PBAF SWI SNF chromatin remodeling complex. Thus, histone methyltransferase gene SETD2, a histone demethylase gene KDM5C, and the novel tumor suppressor gene BAP1, which encodes a histone decubitumase. So this is the inherited renal cell syndrome. First one is VHL, von Hippel-Lindau disease, which is on chromosome 3p25, the VHL gene, and it predisposed to clear cell. Then second is hereditary papillary renal cell carcinoma type 1 is on chromosome 7q31, and the predisposing gene is MET gene, and it leads to type 1 papillary RCC. Then hereditary leiomyomatosis and renal cell RCC is on chromosome 1q40 to 43 FH gene, and it leads to type 2 papillary RCC. Birt-Hot-Dubé syndrome is on 17p11 as FLCN gene, and it leads to chromophore and hybrid oncocytic RCC. Tuberous sclerosis is on 9q34, and that is tuberous sclerosis 1, and 16p13 is on tuberous sclerosis 2. It leads to angiomyolipoma, all histologies. Succinate dehydrogenase associated renal carcinoma 1p35, 1q23, 11q23, SDHB, C, and D. It leads to clear cell, chromophore, and oncocytic neoplasm. BAP1 associated tumor on 3p21, BAP1 gene on clear cell predominantly, and MITF associated RCC 3p13, MITF gene, and clear cell limited reports. Thank you.